Hello, everyone. My name is Professor Drakopoulos. It's an honor to be here with you, and I'm really very pleased to join this event. I represent a medical group here in Greece, in Athens. And today we're going to talk about the programs that we offer, mainly IVF with own eggs and also egg donation programs. So I will start sharing my screen and my presentation with you. So my web address, my email, and we have the Instagram profile, Facebook, and TikTok. So if you want to follow, because we upload quite often some material there. So it's a private fertility center based in Athens. As I said before, it's a medical group. We have a partnership with Institute of Life, which is the biggest IVF clinic in Athens, Greece. It's a state-of-the-art IVF laboratory. And I can say so because I did my studies in Switzerland and in Belgium, so in the best centers over there of IVF. So I have a good idea of what a good lab looks like. So I can tell you, it's a private, of course, IVF center, and I can tell you that we have everything inside, everything that you need in order to increase your success rate. So imagine that annually we have more than 10,000 cycles, IVF cycles, in this center. So just a few words for me. I'm a subspecialist in reproductive medicine. I did my studies in Belgium and Switzerland, where I got trained. I love research. It's part of myself. I have more than 110 publications in high-index journals of the field. I'm an invited speaker in an annual base. I'm currently professor in Brussels in VUB. As I said before, it's one of the biggest and more recognized centers in Europe and also in Cyprus. And my area of expertise is poor ovarian responders. So my research is really about this difficult group of patients, and me and others try to evaluate strategies that could substantially improve the outcome of these women. So the question is, why choose Drakopoulos IVF team? I believe that we try to apply highly individualized protocols, including, of course, duo-stim. Duo-stim is when you do the one stimulation after the other in an attempt to increase the number of oocytes and embryos. PPOS, which is a relatively novel protocol where we give progestin, so oral medication, in order to suppress LH. And primarily, I try to apply a holistic approach. And I think this is very important. In my medical team, we have psychologists, we have dietitians, we have cardiologists, we have medical care specialists. So when we have an IVF patient, it's not only about the number of eggs and try to give her a baby. Of course, this is the ultimate goal. But IVF is a journey, and we need to understand this. So we start with a couple or a patient. We need to evaluate carefully the comorbidities of the patients, evaluate how the patient feels like, because in IVF, we may have a failure, we may have a biochemical pregnancy. So as I said before, it's a journey. So I think that it's very important to have the specialists that you need in order to go beside the patient. We offer high success rates. I will share with you, these are real numbers. It's not publicity. There's no waiting list for IVF with your own eggs. And this is important, we have only 2 months waiting list for fresh egg donation. I think because I know many people in Europe, I think that really the waiting time is very short. Okay, of course, with frozen eggs, it can go very fast, but with fresh eggs, it's only 2 months waiting list. Also, a very important point, and I think this makes us apart from other clinics, is that you can have a direct communication with me. Okay, all my patients have my professional WhatsApp number, and for medical reasons, you can reach out to me, you can have a direct contact with me, and you don't pass through coordinators or other people. So this, I think, it's an important point that you need to take into consideration. You can check also our Google reviews. We have excellent reviews from more than 150 patients. Google score 4.9. I think that it's also an important point to consider. These are some of the people of my team, the psychologists, the midwives. And what do we offer? What do we offer? We offer IVF with own eggs, as I said before. We offer egg donation, either anonymous or non-anonymous. What does it mean? Non-anonymous means that the child could eventually meet the donor at the age of 18. However, I have to say that most couples or women choose anonymity. We offer IVF with donor sperm. The same things applies, anonymous and non-anonymous. Double donation means sperm donor and egg donor. Egg freezing, of course, for medical reasons and social reasons. And IUI. Okay, so these are basically the treatments that we offer in Drakopoulos Reproductive Science. We have all the advanced laboratory and AI technologies in the lab, as I said in the beginning. Embryoscope for almost all patients. Chloe, which is a tool, it's an AI tool in order to evaluate the quality of the oocytes when we do the egg freezing, because as you know very well, when we do the egg freezing, we collect the eggs, but we don't know the potential of these eggs. So due to this AI tool, we can evaluate the morphology and the quality of the eggs, and therefore have a score and a probability that this particular egg will develop to a blastocyst and to a healthy pregnancy. So I think this is very important. Of course, ICSI, that you're all familiar with, IMSI, which is another technique for the selection of the sperm, Zymo, also a novel technique, again, in order to select the sperm with the lower DNA fragmentation index, and MAX, that also has this role to improve the selection of the sperm. PGTA and PGTM, these are genetic tests for the embryos, and I think this is very important, especially PGTA that we use in the majority of patients nowadays. And of course, all andrological procedures, including TESE, micro-TESE, could be performed in our hands. What about other screening tests? All receptivity tests can be done. Immunological profiling of the endometrium, microbiome assessment. Of course, this is for specific cases, okay? But if we think that there is a reason and there is an indication, these tests can be performed. Also for the man, advanced neurological screening tests like DFI, oxidative stress. I know that in Europe, in several countries, the access to this test is not so easy. Here we can have these tests and can be done in a day. PRP, although I'm not a supporter of ovarian PRP because of the poor results that we usually get, we can do PRP and, of course, endometrial PRP for some also specific cases of recurrent implantation failure or thin endometrium. So these are the results of 2025 regarding clinical pregnancy rates. Again, I repeat, these are real results. Okay, these are not that they were not done for promotion or publicity. So the clinical pregnancy rate for women under 35 with their own eggs was almost 60%, and for patients above 40 was 21%. And I'm really very happy with these numbers. Because I know very well from a scientific point of view that these numbers are high above the average for IVF with own eggs. Regarding egg donation, the egg donation program works perfectly. Almost 80% per embryo transfer and very good results with both fresh and frozen donor eggs. As I said in the beginning, our idea, our wish is to work with fresh eggs, but also we can use frozen eggs through an egg bank. As I said before, the success rates are exactly the same. Of course, there are advantages and disadvantages with both procedures that maybe we can analyze later if there is a question. But the results are excellent, and I'm really very happy to share these results with you today. How do we start? So how does this fertility journey start? First, we need to organize an online consultation in order to review the medical file, share with us the exams that have already performed, see the history of previous IVF attempts. And based on that, we're going to discuss together using an evidence-based approach, because for me, this is the most important, to apply evidence-based medicine in order to choose the protocol that will fit to your needs. Okay. Are you a poor responder? Are you a normal responder? Evaluate the protocols that we used in the past, what worked, what didn't work, and how can we improve the final outcome, again, based on evidence, okay, and not give to patients false expectations. For me, this is very important, especially due to my academic role as well. The monitoring can be performed in your home country if you wish. So don't need to come in Greece and stay 12, 14 days for an egg collection, because you know very well a typical IVF cycle may last for 2 weeks. Of course, if a patient wishes to do everything here, we can offer this opportunity, and I will personally do all the ultrasounds. But if this is not possible for logistics, then of course you can perform the monitoring in your own home country. I always go for blood transfer. People that know me can confirm this. I don't do the day 2 or day 3 transfers. I think that there is absolutely no reason. Actually, we have, if we trust our lab, we go always for day 5, and the results are excellent. And of course, there is a continuous follow-up and support. As I said in the beginning, my phone is here, always with me, and for medical reasons, patients can have a direct contact with me. So what are the advantages in Greece in general? So why should the person come in Greece? In Greece, you can do an embryo transfer till the age of 54. Okay, so in the majority of European countries, it's 46, 44, 47. In Greece, it's up the age of 54. So you can go for egg donation till the age of 54. Or if you have frozen embryos in another country, for instance, you can transport them in Greece. Or if you have frozen embryos in Greece following an IVF attempt, you can always use these embryos till the age of 54. PGTA is available. I think this is very important. I believe personally I'm a big supporter of PGTA, and the law in Greece recently changed, because in the past PGTA could be applied for patients after the age of 40. Now it's 38. So the limit the limit of female age is 38. So if a patient is 38 and above, could have access to IVF. Or if a patient is suffering from recurrent miscarriage or recurrent implantation failure, again, PGTA could be applied. Furthermore, single mothers are allowed based on the Greek law. Here is a transparent cost overview. For me, it's very important, and I want to highlight this point, that there are no hidden or add-on fees. So what you see there is what you're going to have at the end. And importantly, embryo monitoring, blood culture, freezing of supplementary embryos, all of these are included in the final price. So IVF with own eggs, the price is 3,800 euros. For egg freezing, depends, it's between 1,700 and 2,600 euros. And why we have we don't have a fixed price? Because this depends on the number of eggs. Okay, if we have more than four eggs, the price is different compared when we have more than four eggs. So the number of eggs could also play a role for the price. Egg donation, 6,200 euros to 6,750 euros. Again, this depends if we go with fresh or frozen eggs. Frozen eggs are a bit higher because we have the intermediate of the egg bank. For a frozen embryo transfer, it's 1,500 euros, and for sperm donation, depends between 500 and 1,000 euros, depends on the profile of the donor that you're going to choose. I receive a lot of international patients. More than 50% of my patients are international, especially from France and Belgium, but also UK and Canada. Why? Because I speak French and English. French because, as I said before, I did my specialty training in Switzerland and my subspecialty training in Belgium, so I'm very fluent in French. I have many patients coming from these countries. Airport pickup, of course, available, hotel accommodation, assistance, all these are offered. And we try to reply very fast so you don't stay at your phone waiting for the coordinator or for me to reply. So I try really to reply very fast in patients coming from abroad. Our mission is to endorse high-level scientific expertise based on evidence again. For me, this is very important. The idea is not to increase the burden, and especially the emotional burden of patients undergoing IVF. I know how it is based on the research that we perform, and honestly, the idea is not to make patients doing cycles when I don't see really advantage. Okay, so we have AI with us. Our approach tries to increase and maximize success rates, and that's why we have the motto, Science of Life, Care for You. I would like to thank you for your attention. Here you can see my website, my email, my Instagram. So please, you can contact me if you wish to. And I think now we have time for questions, and I will be very happy to come to your questions. Just stop sharing the screen. So let's go to the questions now. I have here a question saying, for a donor egg, can I select donors from a catalog at a bank and send to your clinic for the e-cycling? Yes, this can be done. Okay, as I said in the beginning, we work with fresh eggs and frozen eggs. Frozen eggs are mainly through an egg bank, and we collaborate with 2 egg banks, particularly Aphrodite and Ovobank. So there you can have access. And indeed, if it's a profile that is convenient to you, you can come in contact with us and we can accept these eggs. How does matching work and what information can patients receive about the donor? Thank you very much for this question. So regarding fresh egg donation, we take into account your external characteristics, so weight, body weight, color of the hairs, of body skin, so everything that is external. And by default, all donors are below the age of 30. This is for fresh donation. Also, you share a recent photo with us, and then we can try to make the more suitable matching. Then this is for fresh egg donation. Regarding frozen egg donation, so if you go through an egg bank, you can have more information regarding the donor. You can have also photo. Sometimes see photos, recent photos of the donor, and you can have more access to the characteristics of the donor, or sometimes to the social background of the donor. If a patient has already failed IVF cycles elsewhere, what do you typically review first before starting again? The first thing that I review is the preconceptional. I try to take care of the preconceptional status of the patient. I think sometimes we underestimate this, but this is very important. What is the BMI of the patient? If the patient is a smoker or not? So everything that may act in a preconceptional level. Then I always evaluate the protocols that were used, the medication. I see how the monitoring went. What was the number of eggs? What was the maturity of the eggs? How was the embryo development went? So these are important information, and typically I ask my patients to provide me a very detailed history of what has happened in the past. I think this is the most important. Do you offer any guarantee packages, and if so, how does it work? Thank you for the question. Yes, in egg donation, we offer a guarantee of at least 2 good quality blastocysts. Okay, and I can tell you, based on my experience, that it's very rare to have only 2 good quality blastocysts. In the majority of cases, we have 3, 4, and there is no extra cost for the couple. And this is a very important point. And I think also this makes us apart from other clinics. So the guarantee is for 2 blastocysts, of course, under condition that we have a sperm that is acceptable. We don't look for a perfect sperm. But of course, if we have a man with an oligospermia, meaning a very, very, very low concentration, we cannot guarantee 2 good quality blastocysts. But in the majority of cases, this is not the case. So that's why we have a guarantee of 2 good quality blastocysts. Another question is, for international patients, how much of the process can be done remotely and how much time they need to spend in Greece? Okay, thank you for the question. So regarding IVF with own eggs, I think I already replied. Patients can come only for the pickup. Okay, so for the oocyte retrieval, if they can do the monitoring in their own country. In majority of cases, we don't perform fresh embryo transfers for different reasons. We prefer to go for frozen embryo transfer. Of course, this is something that can be discussed with the patient. For egg donation, typically an egg donation program requires 2 visits. So the first visit is in order to open a file, make an official request, and if there is a partner or a husband, freeze the sperm of the partner, so that when we have an available donor, we have sperm in order to proceed with the fertilization. So typically we need 2 visits. The first visit is for the opening the file, make the request, freeze the sperm, and the second visit is in order to do the transfer. And again, for the transfer, we need only a couple of days, usually 2 nights. We use very flexible protocols. We do transfers also during the weekend. So I have many patients coming, for instance, on Friday evening. We do the transfer on a Saturday, and the next day, so Sunday, they can fly back home. Yes, there is another question here that I see. If there is a balanced translocation on the Y chromosome, can we get PGT-SR or embryo get gender results? Yes, of course. If there is a gender transmitted disease, then we can apply PGT. Okay, so this is also based on the law. I mean, it's completely eligible. And yes, the answer is yes. Of course, we don't apply gender selection for social reasons. This is prohibited in Greece and everywhere in Europe. So it's only for medical conditions that we can select the sex of the child, of the embryo. I don't see any other question. I think that I underlined the most important points. Again, I want to repeat that the most important advantage, if you collaborate with us, is the fact that you can have a direct contact with me. And I think it's really advantageous because I have experience with international patients, and always their problem is that they go to another country. Sometimes people don't speak their language, and they don't speak or they don't see even the doctor. So it's not our case. I have a good team of midwives that can help you with regarding the accommodation, regarding all the stuff before your visit, and of course, before when it comes to the medical part, you can always call me, you can always text me. Patients that know me also can confirm that I always reply, maybe not in the same hour, but during the day I will reply. Okay, so we use WhatsApp in order to communicate directly with the patients. And this, I think, it's very important, especially for French-speaking patients, because they're going to trust someone that speaks their own language, and I completely understand this point. Again, all the numbers that I presented regarding live birth and pregnancy rates are real numbers. We try to do our best. Regarding also egg donation, and I want to underline this point, honestly, it's very, very rare not to have a baby at the end of the day. Because as I said before, in fresh egg donation programs, we have usually 4 or 5 blastocysts. So even if we have a pregnancy rate of 70%, means that 1/3 of the patients will not get pregnant with the 2 blastocysts. But if they have 2 or 3 left, I can tell you that based on my experience, there are a very small amount of patients that did not get pregnant at the end of the day. And these patients that did not get pregnant were typical patients with uterus full of fibroids. These were the typical patients that did not get pregnant at the end of the day. 9 out of 10 patients at the end of the day, at the end of an egg donation program, will have a baby, and the majority will have 2 babies. And I think this is very important. So there is no hidden costs after the procedure. Everything is clear. And for me, this is very important to have everything clear since the beginning of the process. For a patient over 40, how do you help them decide between IVF with own eggs and egg donation without losing precious time? Thank you very much for this question. I think this is very important. And as I said, my philosophy is not to increase the burden of these patients, okay? Because as I have done research on poor responders, I know very well how these patients feel. And my philosophy is not to give them false expectation. I think this is very, very important. So for a patient of 40, what I do evaluate is the AMH and data follicle count. For me, this is the most important things. See what is the number of eggs that we expect. Practically, this is what I look for. Then we make a plan. I would always apply PGTA. Okay, if the AMH and the AFC is acceptable, and I can have at least 5-6 blastocysts, then I would go for PGTA with a good chance to have 1 euploid embryo. If the AMH, for instance, is below 0.1 and the patient is 41, 42 and has already undergone 2 or 3 failed IVF transfers, then I would go for egg donation. Okay, so I think this is based, it's a very case-by-case question, depending mainly on the ovarian reserve markers of the patients and the medical history of the patient. I think these are the most important points that make me decide if I go for IVF or for egg donation. Can we purchase oocytes from other banks than the 2 you mentioned? This is something that is under discussion currently. Okay, for now, we have these 2 egg banks. I can tell you that the results are excellent. Okay, I do egg donation transfers every week. Both banks have provided very good results, but also we are working on it. And again, these 2 banks are international banks that are well known. Can embryos formed at your clinic be moved to another clinic in the USA? Yes, of course. Of course. I have to admit that I have many patients, especially from Europe, that they want to transport the embryos to our clinic because, as I said during the presentation, in most European countries, there is a limit for the embryo transfer that is below 50. In Greece, the age limit for the transfer is 54. That's the main reason that patients prefer to transport the embryos in order not to lose their genetic material or not to destroy their genetic material. But in order to come back to your question, yes, the genetic material can be transported everywhere in the world. Okay. Sometimes it's more time consuming, especially if it's outside Europe because other legislations apply. But yes, we had patients transferring their oocytes in Canada, in Australia, in the US. So the reply is yes. Yeah. I don't see any other question. Please, I will stay live for 1 or 2 more minutes. So if there is any question, please let me know. Maybe another point to underline, I think PGTA is very important, so the genetic screening of the embryos. I'm really a big supporter, and I think that this method can give answers to patients. And in order to come back to the previous question, especially when you have a patient above 40, let's say 43, 44, that ends up with 3-4 eggs after the pickup and 1 blastocyst. And if you apply the PGTA, you see that the embryo is genetically abnormal with a trisomy 21, for instance. And then the patient wants to have another IVF cycle, and you do another IVF cycle, again a genetic problem. Then it's more easy for the patient to accept that the problem is not the IVF per se, but the problem is the age and the age-related decline in oocyte quality. How do you regard oocyte stimulation tests in confirming whether the problem lies with the female partner? What do you mean by this question? I mean, when we perform before doing an IVF, we evaluate the ovarian reserve markers, we evaluate the female age, and of course, we evaluate the semen of the patient. Okay. When I'm not sure if this is your question, but if there is a doubt, in some extreme cases, for instance, when you have a good ovarian reserve, a good sperm, and you have a problem in fertilization and embryo development, in these cases, what we can do is to try to split the oocytes. So half of them go with the partner sperm, and half go with donor sperm. So we can see whether the problem comes from the eggs or comes from the sperm. Based on my experience, in the majority of cases, the problem comes from the eggs and not from the sperm. But yeah, this is a typical thing that we do in order to evaluate, in some extreme cases, it's not for every couple, to evaluate where the problem comes from. So yeah, that's all for me. It was a pleasure to share these numbers, this presentation with you. I remain at your disposal. You have my contact, and I will really be glad to help you complete your IVF journey. Thank you very much. Greetings from Greece. Bye.